Hey everyone, Brad Thorpe from ISOFIT. Welcome to another edition of ISOFIT Q&A. It's gonna hot topic. Social media buzz around this one today. Anyways, Mitch, what is today's question of the day?
How can ISOFIT help my recovery from ACL surgery?
Ooh, ACL surgery. Yeah, you guys know the video I'm talking about, where that guy sort of goes back into that sissy squat, blows out his knee. Well, it's not every time you do a sissy squat you're going to blow out your knee. However, it is a very high risk exercise. Now that said, the likelihood you get injured doing an exercise is really low. But ACL injuries, however, whether it's non-contact or contact-based injuries, occur anywhere between 100 and 200,000, I mean, I love the stats on that, times per year in the United States alone. It is one of the leading knee injuries out there affecting humans, right? So one of the things that we're going to talk about is how you help recovery, right? So post-op surgery for a complete rupture, things you got to think about is how are you going to strengthen the knee around it to take some of that stress off it. Obviously, there's different mechanisms you can do to do a surgical replacement, right? So you can harvest some stuff from your semitendinosus. Oftentimes they use your brachioradialis tendon or a pig graft or something like that. All of that comes back to how are you going to strengthen that structure with isometric-based exercise post-surgery. Now, one of the things we've got to look at first is where is the ACL? What does it do? So basically it connects the tibia, which is this bone here, to that femur, right? So on the posterior aspect of the tibia, comes anterior to that, basically in that ridge between the epicondyles, kind of on the inferior aspect of that femur, that leg bone. So what it does, it basically stops, the knee from sliding. So that's tibial translation when you basically have your tibia moving on your femur, right? Oftentimes, like when you're cut and pivot, the mass of your structure still slides. So you get that basic shearing force going across your knee. So we're going to get rid of that. What we're going to do is we're going to show you basically 3 exercises that can help strengthen your quadriceps and also everything else. We're going to push this guy even further out of the way so he's out of the way of the camera. Things you don't even think about. So leg press, you guys have seen this done before. Pretty safe exercise, made super safe with the ISOFIT because it doesn't move. So you're going to be the one controlling the loads. So here, drive up through your calcaneus, and you just want to push up. So depending on where your range is, you may not be able to get down here right away. So what you can do is just slide further back and press up, so effectively altering that knee position. So that is one exercise you guys can do. Real safe, real strategically smart. Now, one thing we also have to think about are these other muscles on the backside. Now, you got your hamstring group. So how do you train your hamstrings with the ISOFIT MSK? Well, what we're going to do to be strategic, so we're going to do it in a supine perspective, not prone. So what I want you to do is just basically leg on top. Now, we get to play with where our tibia is in space. So if I wanted to emphasize your bicep femoris group, I can externally rotate my tibia and pull that down. If I want to be on my medial side, I'm going to internally rotate and pull that down. So that would effectively be targeting more my semitendinosus and semimembranosus hamstring muscles. Now, here's where it gets fancy, right? Because oftentimes when you have a translation type injury, you'll end up injuring other structures within that knee joint, such as your meniscus, your MCL, which is your medial collateral ligament, or your lateral collateral ligament, oftentimes posterior cruciate ligament as well. So we got to be really mindful. Now, one thing I want to draw your attention to, there are about 16 knee ligaments. So there's far more things that can be going on in there than just those 4 commonly used ligamentous terms. So if I want to think, how do I strengthen up that medial side of my knee? Because it's hugely important to prevent injury. It's something as simple as you're standing with a little bit of support, is hip adduction, right? So you're trying to apply force across in that frontal plane of that knee structure. Right? A lot of people do like a Copenhagen to help strengthen up that medial side of your knee. Now they're a highly complex exercise, might be inappropriate for a lot of people, especially post-surgical, right? Now, pre-surgery, they're probably inappropriate for a lot of people too, right? So here you can basically just get really kind of strong. You can also bring that back and around, right? So that way what you're doing is targeting different areas of that medial side of your knee. Because what happens is we traditionally stretch out our hamstring. And if we think about where our hamstring is, right, it's on the back of our leg. But because we don't really understand the architecture very well, so our medial, like our semimembranosus, our semitendinosus is kind of right here. It actually comes down and attaches on the anterior surface of that tibia. Now, what happens is you also have this thing called your sartorius that comes across here and your gracilis that comes down here, and all three of them combine and then come into what's called the pes anserine tendon. And what they do is they stabilize the medial side of your knee. So if you're stretching your hamstrings, you're also destabilizing the medial side of your knee. So before you stretch, think, do I want to destabilize one of these joint structures and then go play my activity? Post-activity, do I want to destabilize some of these structures? What I'd recommend, go through a whole cycle of isometrics to make sure they're neurologically primed and prepared for the activity post-activity. I'll see you tomorrow. ISOFIT Q&A. Peace out.